Hi, everybody. Welcome to our final tips. Looks like everybody's just starting to log on. All your names are popping out for our last time popping up for the last time this summer. So if you can, go ahead and chat in the names and the credentials of the folks who are in the room with you. This is so we can know how many people we're reaching. And I think we're all used to doing all of this by now, but that'll help us a lot. We have a busy day, so I think we'll probably get started before everyone logs on. All right. We're all logging on right on time. Well, let's go ahead and get started. So I'm Rebecca. You're probably sick of hearing me call out my name, and
I am Macrina. Welcome to the last in the series of.
I know, our last tips. We have so appreciated the time that we've gotten to spend with all of you, as we do in every tips. We've learned so much from you. And Dr. Marius from our T.I.P.S steering committee is on to give a welcome. Dr. Marius, do you want to kick us off?
You bet. So thank you everybody for joining. I know we've spent the summer, mostly you've spent the summer learning how to do your jobs well during these ever-changing times. The COVID-19 virus has changed the way we all live, the way we all work, and the way we educate ourselves. We're grateful to the Arizona Telemedicine Program and the team at U of A for facilitating our use of their learning platform. And we're grateful to all of you for spending time with us to stay up to date on immunization strategies and practices. Today, we're going to get the latest news on COVID-19 and look forward to information about a vaccine in development. We're going to discuss the importance of a flu shot this fall to stay healthy and reduce pressure on our healthcare system. Most importantly, we are going to share what we have learned about best practices that lead to high quality healthcare for our patients. We learn about best practices from those of you who do outstanding work in protecting against vaccine preventable diseases. Each year, TAPI rewards practices that reach the very high goal of immunizing 90% of their patients. We look for what works in your offices, and then we teach you the strategies that produce the best results. Let's get started.
Thank you, Dr. Marius. So we're lucky today to have Dr. Karen Lewis on the line. Dr. Lewis is an infectious disease expert and also the medical director for our Arizona Immunization Program. And she has done so much for TAPI over the years, literally has saved thousands of lives by educating the community. And most importantly, I think educating her colleague pediatricians about what they need to do and how they can lead you all in protecting Arizona from vaccine preventable diseases. So we are excited. There's no one in the world who loves vaccines more than Dr. Lewis or knows more about them. So she is the perfect person to talk about our COVID-19 vaccine that's coming, which is something you all said on your evaluations that you wanted to hear about. But we're going to first hear from one of her colleague pediatricians, Dr. Peggy Stemler. And Peggy, I'm sure you all echo our all appreciation to Peggy for talking with us at each of these about COVID-19 a little bit. So Peggy, why don't you tell us our final COVID messages, and then you can kick it to Dr. Lewis, who we're all excited to hear from.
Okay, thanks. And do you have those slides, or am I popping? Oh, here we are. Okay, so this is the data slide for the day, gang, just so that I can give plenty of time for Dr. Lewis. But as of this morning, the reported cases in Arizona overall are a little over 182,000. And from the beginning, we have jumped a considerable amount from the time that the TIP series started. Remembering that these numbers include both confirmed by those PCR or antigen tests and also probable, that have to do with kind of specific definitions of symptoms. But in all of that, even if you've been tested 20 times, you count as one person in this number. Now, on like the sobering note, we are in Arizona nearly at 4,000 individuals who've lost their lives due to COVID. This is still a big deal. And by the way, COVID, as you all know, it's a virus that's around. Nobody has had it before, you know, or there are a few people now that have had it already, but most of us haven't. So most of us will continue to be vulnerable to infection for a while to come. On the right-hand side of this table shows, this is what's called an epi curve. It reports the number of cases, so people who have tested positive for COVID-19, and this is showing you from the beginning of March until now. Now, that little right-hand side of that chart, we know that those bars are going to get taller because there's a lag time in the time that tests are collected and the time that they're reported. There's some, you've heard, I'm sure, in the news that there's some lags there. But what we can say is overall, you know, we did have a peak and are starting to, when people say bend the curve, this is what they're talking about. We kind of went up pretty high at the beginning of July and are starting to bend back downwards, and that's really good. And the other thing that you'll hear discussions of this idea of percent of tests that come back positive, so percent positivity, and that is an indication that helps sort out are the number of positive tests coming back merely because there's more testing or because there's more disease in the community. So the more tests that percent that come back positive, that's an indicator that there's truly more disease in the community and not just more tests being taken. And while these last 2 weeks on this bottom bar graph show dots on them, those dots are not yet reliable because of the lag in the testing, but we are seeing that there was a high statewide of about 21% positivity in mid-July, and it's starting to come back down to the numbers that we can rely on better, from 21 to 19 to 16 to 13% a couple weeks ago. So those are all really good signs. So no matter how good it sounds, everybody has to keep vigilant, keep wearing your face coverings, mask up in public, wash your hands, stay separated from other people, you know, to keep being safe. Watch out for your vulnerable friends and family members, and hang in there as you're all doing this great work. This slide just has, if you get to the handout, so you should be clickable links to a few sources where you can look at this data over time by yourself. And with that, I want to just, again, extend my, I'm so excited to see Dr. Lewis. She is an amazing human being, and I'm so happy to hand this over to her. So Dr. Lewis, take it away.
Okay, next slide. I was asked to talk about the COVID vaccine, and actually there's many COVID vaccines. 200 different institutions in the world are producing COVID vaccines. So I will try to give a short summary of those that are most advanced. Next slide. Just to give you a little background on coronavirus, there are actually coronaviruses that cause just a common cold. There's 4 of them, and about 30% of our colds are due to coronaviruses. But in 2002, there was a severe acute respiratory syndrome coronavirus that in less than a year just died out. In the Middle East, there has been another acute respiratory syndrome linked to camels, and that just kind of smoldering away. And then, of course, this 2009 novel coronavirus. Next. And there's difference in naming that you'll hear. We all talk about COVID, 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 and then we hear about the SARS coronavirus 2. It's SARS coronavirus 2 because it's the second severe acute respiratory syndrome coronavirus. And that's a picture of what it looks, I mean, a representation. And it has these little spikes coming out of it, and those are spike proteins. So when he says SARS-CoV-2, we're talking about the virus. When we're talking about COVID, we're actually talking about the disease. And this is a CT scan of an individual. So you're looking at the heart and the lungs and the shoulder, and then there's this little black thing kind of close to the heart, that's a trachea. And then the lungs should be black like air in the trachea, but they're not. They're filled with fluid. And that's what causes the severe respiratory distress in some patients. Next slide. And this is just a electron microscope of a coronavirus. It's been colorized, but entering the cell. They use the spike proteins to attach to the cell and then enter. So all of the vaccines are working towards antibodies and cellular immunity to those spike proteins. Next. It's essential whenever you're doing vaccine development that you look at vaccine safety. And even though we're going very fast in developing vaccines, we're not cutting corners on the vaccine safety aspect. First, you do animal studies, then you do phase 1, where there's about 50 to 100 people who get the vaccines, how much fever they have, how much swollen arms, they have any unusual side effects. And phase 2 is several hundred people. You also see about their antibodies. Phase 3 is where many or several of the vaccines are right now, where you enroll 30,000 people and you give half of them vaccine and half just get an injection, whether it's, salt water or another vaccine, and they don't know which they got. And then you follow them along and you see how many get coronavirus. And by comparing, you can see how well the vaccine works or doesn't work. And it's only after phase 3 studies and looking at all the safety that the Food and Drug Administration would give an approval to go ahead. And then CDC would give recommendations as to who needs to be prioritized to get it first. And then, of course, you'd follow along and see if there's additional safety issues you weren't aware of in spite of the 30,000 people or 15,000 people who got the vaccine. Next. So I'm just going to talk to you about the vaccines that are being developed. And some of them are messenger RNA vaccines and DNA vaccines. And so I'm just reminding people that almost all the cells in the body have inside of them DNA and messenger RNA. And the DNA, and both of them are codes for, the building blocks of the cells. Each cell has it stains, in this picture, stains darker purple, have a nucleus, and that's where the DNA is. And then it replicates, it codes for a messenger RNA that goes out into the rest of the cell, and that produces the protein. Next. So you may have heard of the Oxford vaccine. They use, this technology is fascinating. It's been used in developing the Ebola virus vaccine. You take a virus, in this case, a chimpanzee virus that causes colds, adenovirus, and it has DNA. and you take the DNA that just produces codes for the spike protein for the COVID-2, and you splice it into the adenovirus DNA. They have technology that can do this. And then as the virus gets into a cell and replicates once, it also produces, and it uses a messenger RNA to do so. It makes spike proteins. And this vaccine, the adenovirus, can't keep replicating, but you get the spike proteins, and the body sees the spike proteins and learns how to develop immunity. Next. There are mRNA vaccines. The Moderna, or the National Institute of Allergy and Infectious Disease vaccine, is mRNA. Pfizer is developing several mRNA vaccines. And what they do is they take the mRNA that codes just for the spike protein, nothing else, and they do a lipid nanoparticle, so it's really tiny so it can get into the cell. Next slide. And then once inside the cell, it produces the spike protein and then it stimulates antibodies and memory cells, T cells, and produces immunity that way. Next, another vaccine, Novavax, just takes a spike protein, no mRNA, no DNA, just a spike protein, but also combines it with an adjuvant. Novavax is Matrix M, and it just makes the immune system sit up and say, oh, there's something here we really need to react to. And next. And then finally, just of the ones that are along getting closer, are starting in phase 3, is Inovio. It has a DNA vaccine. It's called a plasmid because it's kind of round. It codes for the mRNA that codes for the spike protein. And it just goes into your skin, intradermal. It is stable at room temperature for up to a year, but it's bigger than the messenger RNA. So Inovio has a special device that gives the vaccine, but at the same time, it gives a little electrical pulse that temporarily opens up pores in cells and lets the DNA vaccine get in. It's called electroporation. So these are just the 5 I wanted to mention to you about. Next slide. Again, in going fast, you've heard this Operation Warp Speed. How in the world can it be safe if they're going at warp speed? What this is, the program is to pour money into the process so that instead of going leisurely along one step at a time and then waiting to see, well, what does a phase 3 study show? Oh, this is good. We can start manufacturing vaccine. They're giving money to manufacture. So as soon as they started with the phase 3, even before they knew if the vaccine was going to work, they safe, yes, but work. They've started producing millions and millions and millions of vaccines, so that if it turns out that it doesn't work, that's wasted vaccine. But if it does work, and preliminary studies are hopeful, then as soon as there'll be collaboration between government institutions and the private sector, and once it gets the Food and Drug Administration emergency use authorization, it can start going out to the people. So that's where the warp speed is, to just speed the bureaucratic process along, not the scientific, the bureaucratic. Next. We still don't know some things. Many vaccines may require 2 doses. we assume they'll need, you know, Inovio may just need room temperature. We assume most will need refrigeration. Some may need freezer. During the studies, we're going to see what the local reactions are, how much fever, and again, the efficacy. And then we don't know how long the immunity is going to last because we've never done the studies before. Could it be that we're going to need a vaccine every year? Because unfortunately, COVID is going to be around probably for a long time. We'll just have to see. Next slide. And then finally, we don't have a vaccine yet for COVID, but we do for influenza. Influenza vaccine is not perfect, but we know it helps keep people out of the hospital. And we want to save those rooms, those hospital beds for COVID patients. So everybody 6 months and older need a flu vaccine this year. And we'll be updating people more about the COVID vaccines as we get more information from Centers for Disease Control. Any questions?
Well, I think, Dr. Lewis, thank you so much. And I want to make sure people keep chatting in your questions about the vaccine, the COVID-19 vaccine, because Dr. Lewis said she would be able to answer them, you know, with written response, and we'll be sure to email you those out. But one question that we talked in our vaccine basics session, the second TIPS training, about the different types of vaccines, and we give a lot of live vaccines in primary care. Is there a possibility that the COVID-19 vaccine would be live? And that's a question from Andrea.
There is a vaccine that is adenovirus-based, human adenovirus-based, and the chimpanzee adenovirus is live in the sense that, yes, it can still replicate once, to get into the cell and replicate once, but it's not a standard live vaccine. So we'll just have to see how the studies roll out. There's a possibility of live vaccines, and therefore you would not want to use a live vaccine in somebody who has a problem with their immune system.
Right.
Initially, they will not be recommended for pregnant women and children because studies have not been started for them yet.
Oh, that's good to know. Well, thanks so much for joining us. We actually launch, if you could, or Chris, if you could launch our COVID poll. We know that this science is just changing daily about the COVID-19 vaccine, but we're curious what your thoughts are on, you know, where you are in your thinking about what it's going to take to recommend this to your patients. So if you could select those statements that you agree with, and you do have the ability to select more than one, we'd love to see that.
Yeah, for the vaccine nerds in us, this is really exciting time to see all sorts of different technologies being utilized.
Yeah.
And the technologies are wonderful and very, very safe theoretically as well as in studies. And yet people who don't have a science background, I would think, could be frightened by hearing DNA. You're putting DNA in me, not realizing it's a DNA just for the spike protein.
Yeah.
You're not going to change your own DNA. Or chimpanzee virus, are you kidding? So we're going to have to do an education for individuals about what we find out with the studies about the safety. But I want to be one of the first to get vaccines, and I'll take any that I have seen so far.
See that? Maybe we should have made one of the statements. If Dr. Lewis says she'll get it, then I'll get it.
You know, that's good enough. That's good enough for me.
Yeah.
My motto, I did 15 years of pediatric infectious disease work in the hospital. And my motto is, disease is bad, vaccines are good.
Yeah, I think that the results of this poll are really pretty interesting. And I think that what I take away from this is 38% of us say, I really do need more information. And I think that that's good. You know, we don't want to recommend things to patients unless you really understand and you feel comfortable. So, and TAPI will continue, you know, as the vaccine comes out, we'll just keep meeting our mission to educating you and supporting you. So this is helpful for us to know our future and what we'll be doing. And as a reminder, you know, Dr. Lewis talked about making sure that we all get flu shots and recommend flu shots and no missed opportunities for flu shots. We've talked about that a lot this summer, but we've also talked about that COVID, how the pandemic has impacted immunization coverage rates. And we want to make sure that you remember to catch up those children and adults who have canceled appointments or not come in for their annual well visits. It's really important that we don't lose herd immunity. So make sure you're telling patients what you're doing to keep them safe and to keep the offices safe. Make sure you're running those reminder recall systems, calling in your well visits, assessing vaccine status at all visits, using your EMR or ACEs to forecast. And the other thing we want to tell you, which we haven't mentioned yet, is be sure to promote awareness about the VFC program. There's a lot of kids that will now be uninsured as their parents lose their jobs and can still get vaccines if they're uninsured through the VFC program. So make sure that you promote that program, and of course, inform parents about how to get health insurance for their children through Access or Kids Care if they now find themselves without a job. So, but thank you, Dr. Lewis. We're gonna go back to our other vaccine best practice stuff. So
Okay, thank you very much.
Thank you, Dr. Lewis.
Sure.
You know, when we looked through the evaluations and the chats, there were a bunch of things, odds and ends, that we were like, oh, we should probably go over this again or say it a little bit louder. So Macrina and I are going to rapid fire some odds and ends. The first was a lot of people were asking, how do I track down shot records? And we wanted to, you've all had parents or patients come in saying, I know I've gotten that shot, or I know my kid already got that one. And remember, the first place where you want to go is to ACES. All pediatric vaccines that are administered are required by law to be submitted to ACES and have been since 1993. So for kids, they should be in there. Pharmacists are required to submit adult vaccines to ACES. So a lot of us get vaccines from our pharmacies. And also your larger health systems that take care of both kids and adults, they're all setting their EMRs to just send all of the records to ACES for adults. So whether it's a child or an adult who you need that record for, look in ACES first. It might be there.
And another place you can go as well is, I know you get a lot of folks probably from out of state who are having trouble locating records. If you go to the CDC website, and maybe we can put the link up, send out the link, there's a section in the back that actually has contacts for every single state immunization registry. And we use that system a lot at the county health department to try to find records for kiddos who are from out of state. So that's also a resource.
And what do you do for out of country?
So out of country is a little complicated. In Maricopa County, in the Phoenix area, we have both a Guatemalan and a Mexican consulate. So you can actually refer folks who may have not gotten their immunization record and come from Guatemala or Mexico. You can send them back to their consulates and they can help them get those immunization records. But as we all know, if we really can't track down an immunization record, there's no contraindication in giving the vaccines the child needs all over again if you can't find a record to document it.
Okay, great. So check ACES, and there's some chats in here of how do you access ACES. So we'll get you the information about how to sign up for ACES, the state registry. And there's another couple questions Kelly's asking. Where did she say we can find those out-of-state records? So the pink book from CDC.
It's the CDC website. It's the pink book, and it's an appendix. So it's towards the back, and it's actually contact information for all of the state IISs, Immunization Information Systems.
And Laura's chatting in
Okay.
right now too. So, and
And
remember,
again, it's not perfect because everyone started theirs at a different time or a different area, but at least you can try to get something.
yes. And remember that schools and childcares can access ACEs. So they can look in ACEs first. And patients can go to their provider where they think they got it. Just know that they're going to have to sign whatever releases are necessary and maybe have to pay a fee too. So, and please enter historical data into ACEs. The next MA that talks to that same patient and here's that same thing that they got the Shingrix vaccine already would really appreciate you entering that data into ACEs. So the next thing that we got a few comments on is if a parent comes into my office saying, I want these school required vaccines, can't we just count that as a win and not talk about the other ones? And the answer is, it is a win. I mean, anytime a parent chooses to immunize their child is a win. They are less likely to get that disease. But at the same time, every vaccine a parent refuses for a child leaves them susceptible to that disease and impacts our herd immunity.
And I think what really has brought this question up more than anything is the HPV vaccine, right? Because nobody, I'm sure, gets arguments from parents about not giving Prevnar, PCV13, or rotavirus, right? Neither one of those are required for childcare. So I think it's that HPV discussion that has really raised this issue. So normally I just look at parents and just say, you know, you got the PCV13, you got the rotavirus vaccine. Neither one of those are required, but they're needed to protect your children. And no one ever argues about that. So at least have the discussion. Start the conversation with your parents.
Right. And really, you know, in healthcare, you're in the business of evidence-based practice and following clinical guidelines. And the clinical guidelines are published by ACIP. Those are the recommendations. They're not published by the schools or whichever school district that child, you know, in. So we really strongly urge you to talk about what's recommended for those kids, not just what's required. But I think you can pat yourself on the back every time a parent chooses to immunize. It's a win. So thanks. And also, vaccines are required for school this year, whether that school is going exclusively virtually or not. For the time being, vaccines are required. So still plan on doing your back to school clinics if you're in a part of the state where school's not in session yet. So Macrina, another question is, how long can my vaccine stay out of temp range? Okay,
so your refrigerated vaccines, the ones that are at 36 to 46 degrees, they're pretty darn stable. And your freezer vaccines, your MMR, varicella, your ProQuad, they're a little bit more sensitive to temperature and UV light. So they all stay out a little bit, right? You take them out of the fridge, you double check, you draw, you double check, you triple check before you go in the room, you take them into the room, and then you do the holding procedure. So they're usually out, what, a couple, 5-10 minutes by the time you actually are able to immunize, maybe less than that. But when it comes to vaccines, any temperature excursion, you need to follow up on. So if it's VFC vaccine, any temperature excursion, you need to contact VFC program over at ADHS. With your private purchase vaccines, you need to contact your representative, and they will refer you to somebody. Routinely, they can tell you right then and there. All they need to know is how long has it been out of temperature range, and what was the temperature. Now, we all have data loggers where, you know, it dips down to 35 or dips up to maybe 47 and then falls right back into range. Those aren't of any concerns. But anything for any substantial amount of time, you need to check with either your private vaccine rep or the VFC program. I really can't tell you that 5 minutes is okay, 10 minutes is okay. It depends. There's just a lot that is involved.
So for VFC, you call, like, no temperature excursion is okay. You know, you call
Right.
them right away. For Privus, you call your manufacturer or look at the materials that they've provided you to
Right.
make a decision. Macrina, we've been joking that Macrina's hair has looked blue a few times on Zoom. So, hi, blue-haired Macrina. When do
Hi.
you report to VAERS? And we'll
You know,
treaty with
go
this.
ahead. Okay, so with VAERS, it's really what you need to report is anything that's outside and beyond what is considered a typical normal reaction. If you are in doubt and you don't know, it's okay to report. You can report everything to VAERS. They will actually go through that data. They will go through those reports and they will identify which ones are significant and need to be followed up on and which ones are routine and not need follow-up. If in doubt, report. I think that's the best thing that's just the best answer I can give.
And we are going to we're creating a resource based on the discussion that we had 2 weeks ago. There was a lot about what's a typical reaction and what's not. So we are in the process of creating a resource to help you with that and to provide a handout. So when you get that emailed to you, you can thank yourselves for helping to create it.
Oh yeah, thank you so much. That is an incredible tool. That's one thing we actually got. It's the one thing we actually got out of TIPS was that tool.
Right. And there's a couple things in the chat that I just wanted to bring up. And if you have other questions, feel free to chat them in because we're going to go on to more best practices. But Amanda Clark, we'll send you a prize. So, because reminded us that you can try to sign up if you're on a border with other states' registries. So she signed her clinic up for Utah's registry. She must be,
cool.
On the Utah border. So some of you might have the opportunity to do that. So
that's a great idea.
It's a win-win because then Utah will get the data for when they're administered in Arizona. So we have talked about tons of vaccine topics over the last 10 weeks, but we want you all to think about what would it take for 90% of your patients to be up to date on immunizations. So that might seem very aspirational for a lot of you, that 90% of the people who you care for every day are up to date on their immunizations. But there are practices in Arizona who've done just that for their infant and their toddler populations. And every year, T.I.P. provides them with an award named after our founder, the Daniel Cloud Award. And we have a fancy dinner at a fancy country club, and we celebrate all of the practices that we're able to do that. This year, we all signed on to Zoom with our glasses of wine in our homes and celebrated all of these sites that were able to hit 90% coverage levels for their infants or their teens. And in the winter, we'll send the specifications for that award and how you run those reports to all of you, and we really hope that you apply. But when we talk to cloud winners who've been able to hit that goal, we kind of find 5 themes that they do to keep those rates. So the first is that they focus on their data. They really put that in the center of all their efforts. They create a reliable system that happens the same way every time with every patient. They use those evidence-based interventions that we've been talking about over the last 10 weeks. They provide family-centered care, and they use a team-based approach. So we are going to provide you today with some best practices in each of these 5 areas. And we're going to start with data, because if you can't measure something, you can't improve it, right? We've all heard that. And cloud practices really put data at the center of their day-to-day and monitoring those immunization coverage rates and really making sure that as things improve or look like they might be getting worse, that they know right away and they can make those interventions right away. So one of our cloud, and this is Macrina, my new favorite practice picture. It's the socially.
Oh, that's great.
Isn't that great? Yeah. So one of the cloud winners who has done a phenomenal job with data is Phoenix Indian Medical Center. So Christina, tell us what your magic is.
Hi, I'm Christina, the lead CMA at the Phoenix Indian Medical Center for the Pediatric Clinic. So what we do is I chose the, so we're running reports, checking ACEs. We also have a system that's called iCare system, and then we also have our EHR system. So we also do run charts with, we also have our PHN involved in our run charts. And then we also have this thing over at the pediatric clinic called the Unit Practice Council for our pediatric clinic. It's kind of like I think it's like a club, but we have a co-chair, chair, and a member and a member and a member. So what we do is we try to come up with running reports, checking ACEs, and not only that, I also emphasize that the clinical support staff at the pediatric clinic, each and one of those individuals do their best on doing the one and done and recalling the patients back, especially during this COVID time. I mean, we are reaching out to those patients, and especially if they need those immunizations, we are doing our best to bring them in, even though if they're due for a well child check, but if our most important one is getting them immunized, because we don't want another outbreak of measles or chickenpox. So we really want to emphasize that. So we are using the iCare system and bringing those patients back, and we are monitoring those data as well. And then I also have that PHN that runs the charting system as well. So
Thank you. So, and thanks for being brave to share, Christina. So we, so you're looking at, how often do you look at your run charts?
So we run them at least every quarter. So our next quarterly run would be in September.
Oh, cool. So that's just, you know, a way to display your data and share it, communicate it back to the whole team. Does everyone look at the data on those run charts, or just your vaccine?
So definitely we do. We have our monthly meetings. We have 2 at least a month in our pediatric clinic. So we have like the beginning of the month, the first week, and then we have a second week. And so when we run those data, we always, usually I share with them, or if our PHN shares. So we do share those data. And I don't know if you guys can see this, but I print them out, but this is the last time since COVID happened was back in March. And this is the recent one I have, if anybody can see it.
Cool.
I'm sorry, it's kind of a little bit backwards probably. So we try to keep up with it. So, but our next run is not until September, but if you can see, this was back from March. So after COVID hit, we kind of put everything at a pause, and then, but we are still immunizing. We are still bringing those patients back, but we are doing it with precaution and safely.
That's so cool. Well, thank you for everything you do. Yeah. So we have a poll too we'd like to know how you monitor your immunization coverage levels. Chris, can you launch the monitor poll? And while you're running that, I think what we heard from Christina is really what we hear from all the other cloud winners. They run those reports regularly, but they look at those reports regularly. And I think that that's the part that we sometimes have a hard time doing, is finding the time. So standing meetings that are already on your calendars. You know, if you huddle in the beginning of the day to go over your patients, you know, the person whose job it was to run that report that month or that quarter shows it and says, here's where it is posted in the break room or on the refrigerator or wherever that you put it. So the next thing that and looks like a lot of people are, very few of you do not monitor immunization coverage levels, which is great. So most of you are running reports through ACEs or queries through your EMR. It's wonderful. So the next thing is that cloud winners do is create a reliable system. So when we talk about reliability, you know, every system, they say, is perfectly designed to get the results that it gets. And cloud winners have reliable systems. They get to 90% coverage, but they stay at 90% coverage. So even if you looked at what Christina showed on the screen, that line wasn't jumping all over the place on that run chart that she showed. It stayed pretty smooth across. There was one little dip that I saw. Maybe Christina went on vacation that month or something. But you know, cloud winners kind of stay pretty stagnant. And the reason why is because they have reliable systems. So when we talk about reliable systems, we mean everyone in the clinic does the same thing the same way with every patient. So that workflow is documented, it's actually written down, but the procedures that implement the workflow are done consistently across the whole staff. So when you think about going to Starbucks and you get your fancy drink, whether you get that in Maryvale or Yuma or Sholo or Tokyo, it tastes the same. You order the same. The barista put the same ingredients in the same way. So the reliable cloud winners tend to have that workflow written down, but they also make it easy to follow those procedures. And one good example of this is, you know, a lot of people have a policy that says they're going to check immunization status at scheduling. But when it's one thing to have that written down as a policy and to train your staff in doing that. But if your scheduling system actually doesn't let you book the appointment until the person who's booking the appointment looks at immunization status, then you're more assured that that's going to happen every time someone books an appointment. Making those things easy to follow is really important. And technology is a big way that you can use that. Flagging charts, having automatically generated reports. Don't make it someone's job to run those reports monthly, but make sure that it's built into the system that they just spit out monthly so that it's already done. Having things in your EMR that help you not rely on face-to-face communication. So when you room a patient, you know that they're hesitant, instead of leaving that room and kind of running around looking for your provider, to tell them, hey, this is hesitant, assigning them a task through the EMR so that when the provider looks at their screen before they walk into that patient room, they already know that they're going to need to make time to answer those questions that the family has. And
I think I also like, I'm going to interrupt. The small tests of change, I think sometimes, and I'm guilty of this, is that you go in and you want to create this whole new system and all this change, and you want to see results really, really quickly. If all you can do is say, I'm going to ask about immunizations at the time of the appointment, then do that. Make sure that happens all the time, and then slowly add things onto your system. And don't give up too soon. Never give up too soon. Because I think that sometimes we get all excited and we want to put a lot of energy and effort into something, and we drive everybody crazy, we drive all our coworkers crazy with all these new systems. Little things add up over time, and then it's going to be big change.
Yes. And I think that's what we hear too, especially when there's a vaccine schedule change, which we are all going to get ready for with COVID-19, right? That's going to be a big schedule change, especially for those of you who care exclusively for adults. And we don't want to change everything all at once in one day. Do small tests of change. Try a process on one patient or with one MA provider dyad before you walk in and say, from now on, all of the nurses are doing all the screening and not the MAs anymore. Try it once first to see if the nurses have time to do that. Or if they do it as efficiently or whatever. So that's a huge thing, doing those baby steps. So the third thing is evidence-based interventions, and we've talked about these throughout for 2 weeks, or for the last 10 weeks. So reminder, recall, patients need to be told by text, email, carrier pigeon, or whatever, that it's time for them to come in to the office to initiate a series or complete a series. We actually went through on the second tip session. Megan from the VFC program showed you how to do reminder, recall, and ACES. So if you didn't see that, make sure you watch the recording. The second one is standing orders. And we know that we talked about that 2 weeks ago. and sent you some resources, and just making sure that you reduce missed opportunities by screening at every visit, sick or well, for vaccines.
And when you do reminder recall, you don't have to do the whole thing. You can do just MMR. You can do 4th DTaP. You can do 3rd DTaP. You don't have to do the entire series or multiple vaccines. That makes it a little bit simpler and seems a little bit less overwhelming.
Yes. So our one of the cloud winners that does a lot of work in evidence-based interventions and in creating a reliable system is Chiricahua Community Health Center. And we're happy to have Celeste on from there. So Celeste, tell us what your magic is down at Chiricahua.
Thank you, Rebecca. So we've done we've hit this in multiple areas. We've started developing this pediatric program many, many years ago. We are lucky enough that our CEO is a pediatrician, so that is a big focus of his, of course. One thing that we've done is that we developed many years ago standing orders for all of our pediatric immunizations. We spent a lot of time yearly training all of our pediatric medical assistants on not only the administration of our immunizations, but also really in-depth education as to what the immunization protects our patients against, so that they can provide, in return, education to our parents. We still run into many parents that are not open to immunizing their children, or that they would like to do an alternative schedule. So what we have done is, with our standing orders, our medical assistants are asked to pull ACEs to review the immunization records for our patients at every visit, regardless whether they are an acute visit or a preventative visit. Anytime a child comes in, they are to review that. Anytime a child is due for an immunization, during the rooming process, our medical assistant will go over any immunizations the child is due for. Then they are able to educate our parents as to any questions that they may have, and then they automatically place the order in the chart for those based on the standing order. If there's any refusal for the parents, or they've done all of the education that they are able to do during the rooming process, and we still have a refusal, then they notate that in the intake notes. So our staff does their chief complaint documentation in the intake notes of our EHR system, and they will specify there that they have spoken to the parents in regards to vaccine A, B, and C, and the parent has still refused. That way, the provider, when the provider comes in to see the child, or in this case of COVID, where we are doing about 90% of our visits telehealth, the provider knows automatically that they need to address the vaccines with the parents during the time of the visit as well. Another thing that we have done is, in our 2 pediatric centers, we have two of our big pediatric centers, we've implemented an immunization specialist position. They are our experts. So they're responsible for making sure that the recall systems are in place, that they pull those reports monthly, and they provide those reports to our patient care teams so that they can reach out to those children who are due for immunizations who are not scheduled. So we're hitting the ones that are scheduled, that are coming into the clinic, or that are being seen during the office visits, but then we also reach out to those that we have not seen that are due for vaccines. The immunization specialists work in we have extended hours. We have actually opened up a pediatric immunization clinic that is open 6 days a week for our Sierra Vista and our Douglas community. And that is open to any child, not just patients at Chiricahua Community Health Centers, but any child in the communities that may be due for immunization. They can come in anytime between 7 a.m. to 7 p.m. Monday through Thursday, and then 7 a.m. to 5 p.m. Fridays, and Saturdays 9 to 3. so that they can get that their immunizations up to date. So that's a little bit of what we have done in the past several years. We're hoping to pass that along to our adults. We're focusing on our adult standing orders at this time.
Oh, that's great. Well, you do amazing work down there, and Estrelita Montoya is chatting in hi. That I know you can't see it, but she says she's known you since she was a teenager, and people are excited that Cochise County is getting represented. Yeah,
Thank you. I'm very proud. Born and raised here, so I'm very proud to make a big difference in my community.
Oh, well, we're glad you are too. Thank you. And you know, Chiricahua they're well care experts. I mean, really focus on pediatric well care. So I'm sure Celeste would love to share some of those ideas with you. And you know, we want to talk about family-centered care, but that idea of if you're in a community where you're able to have a clinic where they can walk in like that. I mean, talk about family-centered, because we all have crazy schedules, but these families with small young children, especially in a rural area where they could be driving hours, right, to get to your clinic. That's truly family-centered. So when you're already going to Walmart, you can stop by at the clinic and get your clinics or get your shots, right?
Exactly, yes. And that's
so,
the reason why we've made it available for all of the patients during all of our extended hours, so that we are eliminating any type of barrier.
That's wonderful. Thank you. I wish, Macrina, that we would have just had all of them do this whole day. So maybe, yeah. Next
I
time.
know. Yep.
Yeah. So family-centered care is really important. You know, it's not a family's job to listen to us. It's our job to listen to our families and to really hear their concerns, educate them, and help things make sense to them. So, and when we say make sense to them, obviously with, you know, rooming providers that speak the same language when possible, so that they can speak to their families in their native language, but also having, you know, helping them prioritize their health by scheduling appointments before they leave, and really just partnering with families in a way that makes helps them direct their healthcare decisions, because they have those decisions, not us. And another thing with family-centered care that's related is culturally competent care. And you know, racial and ethnic disparities exist in all aspects of our society, but they are nowhere better documented than in healthcare. And this is really not about political correctness when it comes to healthcare workers. This is about truly valuing diversity and helping to recognize that those differences should be celebrated, but also are really good in helping make decisions that mirror what our values are, whatever those are. So we will send you some resources from the Institute on Patient and Family-Centered Care, which are fabulous. We'll give you a link to those. But in terms of cultural competence, we just wanted to remind you all that it's okay to ask questions and be humble. So, I mean, Macrina, how many countries do you think of origin do your patients have? You must always find people from new countries that you've never interacted with.
You know, I can't even begin to guess, but I do know that I have every single BIS printed up and laminated in every single language, because people come from all over the world. And a lot of their frustration is not only with the vaccines, but everyone documents differently all over the world.
Right.
So I think it's listening to folks and how things are documented and where they came from, and answering their questions. And they're more than happy to get the vaccines. They just want to feel they're listened to, and that you respect their country, where they came from, and their immunization record, and then you can move forward. Yes. And the thing with family approach, I think immunizations is really kind of easy and fun when it comes to a family approach technique, because by immunizing kids, you protect parents, and by immunizing parents, you protect kids, and then everyone protects grandma and grandpa, and you know, and the nice neighbor across the street. So it's like one thing that you do that takes care of everybody in that household.
Right.
And I think I get so excited when you talk about that they just kind of fall right in with you.
Yes. And Mountain Park Health Center provides family-centered care with a team-based approach. They have a reliable system. They rock it. Maria, the Mountain Park Health Center has received the Cloud Awards for 20 years. So Maria, please tell us, what is the secret sauce at Mountain Park?
Well, we at Mountain Park, we really believe that one of the biggest key factors to the success of our immunization program is the team approach. So for us, it begins with the individual training that each new MA receives when onboarding with Mountain Park Health Center. So one of the biggest things that we teach them is the chart prep. It's to prepare for the next day. And especially in focusing in pediatrics, it's making sure that they cross-reference not only our EMR, but also with ACEs to make sure that everything's matching, that patient is truly due for vaccines, and then take it a step further. Look inside their patient documents and see if we have their shot record scanned in. If it's a brand new patient and we don't have any records for them, then give them a reminder recall, just a reminder call to make sure that they bring in their immunization record the next day. I really think like this has made a big difference with the MAs, because I feel like they feel empowered and they feel like they're able to understand the process a little bit more. Also, what we do is we involve the providers a lot. The communication is a big part as well. Whenever there's an update or a change, we communicate that with everybody during our staff meetings. We also run, like the other facilities, we run the reminder recalls on a quarterly basis, and getting those patients back in to catch them up for immunizations. We do go back through and kind of clean it up a little bit before we start involving the rest of the staff to help call back those patients. Right now, because of the current health situation, even our behavioral health team has stepped up and they're helping us do our reminder recalls to help ease those patients, those parents that may have concerns about bringing in their kids during this time. We offer a variety of appointments starting at 7:30 to 8 at night. So we can really have the parents bring them in first thing in the morning if they want to kind of avoid the flow of patients, or as well the late hours to help out those parents that aren't able to bring their kids during regular office hours.
Yeah, that's such a good wraparound of everything that we've said, we've heard. So, and congrats on 20 years. That's really hard. So.
Thank you.
This has really been fun to hear from all the cloud winners. I want to make sure we turn it over to Dr. Marius so that she can say goodbye to all of us one last time. We do have in September, we're doing a session called 10 Things You Need to Know, and that's geared towards anyone who educates about vaccines. So we'll make sure that we send that to you. We especially want you, as medical assistants and nurses, you might be interested, but your community health workers, your health educators, the WIC staff that work in your, in your FQHC, this is really a much broader audience. But Dr. Marius, why don't you help us say goodbye?
Thanks, Rebecca. We wanted to thank everybody for joining us today and for asking such wonderful questions. The chat bar on the side is pretty amazing. Our learning process at T.I.P. requires that you educate us about the challenges that you face on a day-to-day basis. Then our job is to find ways to make your job easier so that you can continue to work with families preventing disease by vaccinating. So please stay in touch, use the resources that have been shared with you, download educational materials from T.I.P.'s website, and stay in the conversation by joining us on Facebook. My picture just changed. Be proud of your role in protecting the health of your community. As a member of the T.I.P.S Steering Committee, I want to offer congratulations to everyone on your commitment over these weeks to learning and keeping up the good work that you do every day. Have a wonderful afternoon.
Thank you all. And we're going to have prizes for everyone who does their evaluation. That's why I changed the screen, because there were other things we wanted to say, but that one was really, really important. So all of you who wrote on your evaluations, we need more prizes. Everyone will get something if you complete the evaluation. And we will be.
Rebecca runs a tight ship, so you have to complete an evaluation.
Yes. And is there, and I think we've gotten to most of the questions. If you have, we've been keeping this, and we went a little bit over, but I liked hearing from the clinics. But if there's any other questions that you have for us, go ahead and chat them in and we'll get to them. I think we've answered almost everything though. People are saying they want to be added to the 10 things.
Yeah, the 10 things is really great because it's going to give you some information to help answer some of those hard questions like autism and preservatives and is the immune system strong enough, things like that.
Yeah. Just getting people saying, yeah, add me to that. And we really tell your friend who works at a school district, tell.
And you don't have to be a healthcare worker, a nurse, an MA, an LPN, a doc. Actually, anybody that goes out and talks to families or works with families that have children who talk about immunizations and the importance of it. It's really for anybody who's going to have those conversations with families. It really is. Again, it gives you a lot of information so you can help answer those tough questions.
So there's a couple questions popping up about the certificates for this session. So we will be sending everyone who attended and logged in a certificate. We know that some of you had multiple people in the room or some people in for some sessions and not all sessions. And if you came late, you may have forgotten to chat in the names of those people. So you will be able to write your own name on the certificate, just like you would if you attended live. We don't give individual certificates. And then you can indicate which sessions you participated in live, this through Zoom, or watch the recording on. So, but you'll be emailed that. And all of our stuff, so I was not able, Josephine says, to make the first session. Can I still make that up or on the recording? Absolutely. So if you go on our T.I.P.S website, and we'll send this link out too, but it's whyimmunize.org/TAPI-training. And that has all of our materials. It has the slides, recordings, handouts that we thought of while we were talking. So. Oh, it looks like the survey is not letting you select all 5. So we'll make sure to fix that really quickly. Maybe Laura, you can go log in and fix that really quickly to make sure that they can select more than one option. We can't be perfect, right, Macarena?
Well, we try to be, but things happen.
Yeah. So while these questions are bubbling in, this screen here, which we didn't get time to talk about, was all of the things that you all said you wanted to do differently. We really hope that you do what you said you wanted to do. So after each session on the evaluation, we ask you, what's one thing you want to do differently? And it was so cool to see the trends, because you would have like 50 or 100 people say, I need to put water bottles in our refrigerator. And we hope that you have talked to your office manager or whoever orders that kind of stuff and that you've done it already. And if not, that you left today inspired to do it. A lot of people wanted to tell the rest of your team what you learned. So how are you going to do that? How do you do that, Macrina, after you leave a conference or something?
Oh, sometimes that's difficult, but you know, if you have a team meeting, you can share information. If you just have like a huddle every morning, you can cover just a little bit of each one of those every day. A lot of times I'll print out the information and I'll give it to my coworkers so they can read it on their own. I know that it's hard in busy offices and places to actually have time to share what you've learned with all of them. But again, little snippets, maybe at your morning huddle or at lunchtime, you can talk about it.
And some of these are kind of easy to get done, you know, kind of stupid little stuff that they can do. And some of them are a little bit harder. So if there's ever anything that we can do to help you improve your systems, please call T.I.P., call Macrina. Should we post your personal cell phone number right here on the recorded webinar, Macrina?
Sure.
Call us. We'll send you all our information. Yeah, because we do it. That's what we're here for. That's T.I.P.'s mission, to support you and implementing these best practices. Okay, I think that our chats have kind of slowed down. Now we're getting a lot of just thank yous. So I think that we're probably gonna log off here. We will make sure to fix that question on the evaluation. When will T.I.P. have the next training? We will email you when the 10 things training is scheduled and finalized. And as soon as these chats, I want to make sure that they don't have to dig out our email addresses. I think they're settled down here. All right. Well, fill out your evaluation so that you get your prize. Thank you so much.
Thanks, everyone.
We will send a link to the survey, or as soon as this closes out, it will automatically, as soon as we hit X, it'll automatically get you to that link. So thank you all so much.